Good morning. It's a great pleasure for me to present to you this morning, although only virtually, on WHO's global guidance on protecting children from the harmful impact of food marketing. Thank you for the invitation. I'm Katrin Engelhardt, currently leading the technical work on food environment policies at WHO headquarters in Geneva. So to set the scene for today's presentation, I'd like to reiterate the global commitments to reduce all forms of malnutrition that member states of WHO have made now over a decade ago by adopting 6 global nutrition and 9 global NCD targets, 3 of which directly link to diets, including halting the increase in obesity, reducing sodium intake, and reducing the prevalence of hypertension. These targets also contribute to SDGs 2 and 3. Importantly, at this year's World Health Assembly in May, member states have endorsed the extension of the nutrition targets until 2030. And this renewed commitment is critical as the world is indeed largely off track to achieve the global targets. There are many reasons why this is the case, obviously, but one of the biggest challenges also that consumers face is that although we have guidance on healthy diets and healthy dietary patterns, and we also have guidance on actions to take, there is a big misalignment between the foods that are marketed to consumers and that consumers have available to them, that are accessible and that are affordable. A concern is that marketing is indeed normalizing the consumption of foods that are making us sick. In the context of the discussions today, the focus is on health-harming marketing of breast milk substitutes, commercial complementary foods, and foods and non-alcoholic beverages. There are many powerful actors engaged in this aggressive marketing of such foods, and member states can and they have used the law to protect consumers against such marketing by adopting global guidance, including recommendations endorsed by the World Health Assembly. I'll present those to you in the coming slides. So let me start with the guidance on protecting, promoting, and supporting breastfeeding. The foundational recommendations are laid down in the International Code of Marketing of Breast Milk Substitutes. This code applies not only to infant formula, but also to follow-up formulas, milks for young children up to 36 months, foods or liquids for infants under 6 months, but also feeding bottles and teats. The key provisions of the code, which are nicely laid down in the document on the top right corner of the slide, include, for example, no advertising or promotion of these products to the public, no health or nutrition claims, no free samples to mothers, families, or healthcare workers, no free or low-cost supplies to any part of the health system, that all information materials must explain the benefits of breastfeeding and the superiority of breastfeeding, and that complementary food labels must avoid any cross-promotion, and that all products must meet quality standards aligned at a minimum with the Codex. Since adoption of the code, the World Health Assembly has passed several follow-up resolutions, including a very important one, 69.9, on ending inappropriate promotion of foods for infants and young children, which includes not only the products covered by the code, the breast milk substitutes, but also commercial complementary foods. And these include, for example, baby cereals, purees, snacks, biscuits, juices, etc., that are marketed as suitable for children from birth up to the age of 36. A potential challenge is how to identify which product should and should not be promoted. And to help us with this, 2 regions, the Southeast Asian and the European region, have developed nutrient promotion and profile models, which include criteria such as nutrient composition, age appropriateness, and labeling. So moving on to the marketing of foods for older children and adolescents, WHO has issued numerous calls to protect children from the marketing of unhealthy foods. And the first being the set of recommendations on marketing to children endorsed already at the 63rd World Health Assembly in 2010, and the subsequent implementation framework in 2012, as well as numerous calls in global and regional action plans, as well as the recommendations that were issued in the WHO's Commissions on Ending Childhood Obesity report in 2015. All regions have also developed nutrient profile models to support countries identify which foods to be restricted from marketing. However, until now, country action remains insufficient. It is difficult to provide a best practice example, as no country to date comprehensively protects children from health-harming food marketing through legally enforceable measures. Only some countries, for example, protect children up to the age of 18, such as Ireland, the Republic of Korea, and Turkey, and most recently Norway. Only some countries' policies cover a broad set of marketing communication channels, such as at subnational level Quebec. Only some cover a broad set of persuasive techniques that appeal to children, such as Peru. Only few countries apply strict food classification systems that really help identify the most unhealthy foods that are marketed to children, such as Turkey or Chile. And often effective enforcement mechanisms are lacking that impose sanctions sufficiently high to deter non-compliance. As some countries have implemented now strong policy elements, evidence is becoming more and more available on the effectiveness of these policy measures. A systematic review commissioned by WHO actually enabled the formulation of updated recommendations following the 2010 set of recommendations. So the evidence enabled us to formulate recommendations on policy design elements that really showed to be the most effective. These include, as you can see on the right-hand side, these included mandatory policies, which were more effective than voluntary policies, or provisions to protect children of all ages up to the age of 18, not just up to the age of 12 or 14. To use government rather than an industry-led food classification system, that policies should be sufficiently comprehensive to limit loopholes that enable shifting marketing to other channels, and that policies should reduce the power to persuade. Together with UNICEF, WHO has developed this global implementation guidance on taking action to protect children from the harmful impact of food marketing through a child rights-based lens. I won't go into this into too much detail because the action points really align well with the regional operational manual that you'll be hearing about more in detail today. So while traditional marketing remains a concern, even though we do know what policy design elements are most effective to protect children, digital marketing is starting to amplify messages to all population groups, but especially to children. Digital marketing is characterized by direct engagement with children. It encourages peer sharing of marketing content, and also it enables a rapid spread through peer networks and the creation of user-generated promotional content through hashtags, likes, shares, and other tags. Digital marketing also promotes goods and services and brands through games. And of great concern is the extraction of personal data for micro-targeted marketing, especially when taking into consideration the child rights of privacy. So some forms of digital marketing are similar to marketing in the physical environment, but others, also shown on the screen, are very specific to the digital space, obviously. And importantly, these include things like influencer marketing or user engagement. I'm sure you've heard some of these examples already in the introductory presentation, but it's important to keep in mind that this list is non-exhaustive and it will keep evolving over time. Recognizing the threat of digital marketing, WHO, through our public health law and policy team colleagues in Geneva, developed guidance on restricting marketing in the context of health-harming products more broadly, which also include alcohol and tobacco in addition to foods. The publication provides insights into the many often fragmented laws applicable to digital marketing, including consumer protection laws, audiovisual or broadcasting laws, data protection laws, marketing laws, and it introduces the concept of jurisdiction and provides guidance on defining the jurisdictional scope for marketing restrictions. Due to limited time, I can't go into too much detail, but encourage you to check out the webinar series, which really introduces this guidance in detail, and you can scan the QR code to access the webinar series. While restricting digital marketing may seem complex and overwhelming, countries have already taken action. For example, the UK, instead of requiring advertisers or online platforms to predict the age of their audience, through the Communications Act, they have established a watershed and on-demand programs such as Netflix, a full ban of unhealthy food ads in online platforms. France, for example, has adopted an influencer law to define influencers, to ban marketing of specific product categories and require disclosure of all other ads. Other countries have adopted guidance to clarify how existing legislation applies to influencers. An example is provided from India in the image on endorsement know-hows. And in relation to monitoring, the EU, through the Digital Services Act, for example, requires big online platforms to keep ad repositories with ad content, advertiser, and targeting parameters, and also information on the audience reached, which enables authorities to see and to investigate all available ads. This is shown in the image on the right, so bottom right. Some countries have also developed AI tools to scan a large number of ads online. Actually, our colleagues in the WHO European office have developed the Kid Ad app, but also colleagues, for example, from the Collaborating Centre at Deakin Uni in Australia, have developed similar ads to capture the online ads of unhealthy foods that children see on their devices to monitor digital marketing, such as the image in the middle of the screen. So this is the last piece of global guidance that I'll share with you today, and it's really important because we started with the code of marketing of breast milk substitutes, but considering that digital technologies are increasingly used also to market breast milk substitutes and are becoming the predominant channel for marketing, WHO has now issued also guidance on regulatory measures aimed at restricting digital marketing of breast milk substitutes, which include products within the scope of the code and commercial complementary foods. The guidance document includes 11 really important recommendations for governments. I just pulled out 3 in the interest of time, which include the importance of monitoring and acting on prohibited marketing all along the digital marketing value chain, the importance of enforcing measures by applying effective, proportionate, dissuasive sanctions and for non-compliance, and the importance of continuously monitoring developments in digital technologies, as this is really fast evolving. So to end, I'd first like to thank my colleagues Elizabeth Ruiz, who focuses on digital marketing within WHO headquarters, and for any more detailed questions on digital marketing, I'm sure she'll be able to provide important insights and answers. And I'd also like to thank Larry Grummerstrand, who focuses, of course, on the code and subsequent resolutions and the guidance on regulating digital marketing of breast milk substitutes. So thank you very much for your attention.